My name is Sally Kandah, and I will be talking to you about SIDS today. A quick agenda, we'll do an intro, we'll go over some statistics, we'll talk about risk factors, causes, and prevention. And I have no conflicts of interest to disclose, and the presentation is for educational purposes only. Now, what is SIDS? It was previously known as crib or cot death, and it's defined as the sudden death of an infant younger than one years of age, with no explanation after a thorough investigation has been done. And that may include the autopsy, examination of the death scene, and review of the clinical history. And it's actually the leading cause of infant mortality between 1 month and 1 years of age in the US. And why autopsy? That may seem like such a big thing, but there are many other explanations for sudden, unexpected infant death that can mimic SIDS. And those include, but they're not limited to the following list, things like sepsis or infection, asphyxiation, metabolic causes or problems with how the body makes and uses energy, poisoning, sickle cell crisis, heart problems, pneumonia, brain trauma, or brain malformations. Now, the risk of SIDS in the US is less than 1 per 1,000 live births, and higher rates are seen, like 2 to 3 times the national average, are actually found in Black and Native American or Alaska Native children. I misspelled Native there. But a disproportionately high rate of SIDS occurs in childcare settings. And the risk is slightly more in boys in one study they looked at. But the good news is it has declined in countries that have adopted the back to sleep campaigns. In the US, for example, the incidence has declined by more than 50% since the mid 1980s. Now, risk factors, they've looked at a lot of them. There's a lot that have been identified in the observational and case control studies. And things that are consistently identified as independent risk factors include mainly maternal factors and infant or environmental factors. So the maternal factors are young maternal age, maternal smoking during pregnancy, and late or no prenatal care. And infant and environmental factors include preterm birth and or low birth weight. So sleeping on the belly, prone sleeping position, sleeping on a soft surface and or with bedding accessories such as loose blankets and pillows, bed sharing, and overheating, which is what you were talking about with, those big jackets in the car seat.
Yes. And quick question about that, really quick. About the
Yeah,
sleeping on the stomach. Are you not allowed to place the baby on the stomach at all, or just not for long periods of time? I think a lot of
I
people
think
get confused about that sometimes.
Yes, I think mainly when the baby's sleeping and not supervised. But if the baby is awake and supervised, we actually do encourage tummy time all the time
Okay.
to kind of strengthen their muscles and to help with their development. So once they're awake and supervised, tummy time can start as early as right after birth with like putting them on their belly on your chest. Even when they still have the umbilical stump, a lot of parents ask me if it's okay to put the baby on the belly with the belly button stump still there. And
Hmm.
that's totally fine as long as the baby is awake and supervised. Now, but once they are asleep, that recommendation is really to put them on their back. Yeah, yeah, of course. And there are some protective factors that we should talk about and that should be kept in mind when talking about SIDS. And these effects are generally weak, so they don't outweigh the risk factors that we just talked about, but they're important to keep in mind. And one is breastfeeding. There was a big meta-analysis that showed that breastfeeding for at least 2 months nearly half the risk of SIDS after controlling for potential confounders. So meaning they looked at other things that can cause SIDS and made sure that those were eliminated, such as sleep position, bed sharing, smoke exposure, and socio-demographic factors. And then they said, okay, let's see if breastfeeding decreases the risk, and they saw that it does. Room sharing also, so having the baby in a separate bassinet next to you for the first 6 months of life also decreases the risk. Pacifier use, they can't really explain why, but babies who use pacifier were less likely to die of SIDS. And then immunizations, I know it's a big topic right now. out there with vaccines.
Yeah.
But they're actually, yeah, there's been no studies showing an association with DTaP or other vaccines. And there's actually some that are showing a protective effect, or like kids who are vaccinated were less likely to die of SIDS. So,
Mm,
um, yeah, so I know that's one big one these days. And then what causes SIDS? For the longest time, we didn't really know, and we still don't really know the answer. There's just some proposed theories. And the way they proposed it is in this like triple risk model, they call it. So, underlying vulnerability, meaning is there a genetic pattern or a brainstem abnormality, usually accompanied by a trigger event. So, something like airflow obstruction, maternal smoking, or infection, and then a vulnerable developmental stage. So what age is the baby at? And then I dive in a little bit more about those theories. For brain abnormalities, they have seen some subtle abnormalities in the regulation of kind of what regulates our heart and respiratory system and sleep arousal patterns. They've seen that in kids who have died of SIDS. There were some maternal and antenatal risk factors that lead to a less than optimal, so intrauterine environment, potentially leading to brain disorders. And abnormalities in serotonin signaling. This is a big one that they've seen. Maybe some studies have showed that delayed maturation in certain regions of the brain, and those certain areas participate in responses to low oxygen. So they've seen that maybe, hey, some of these are not really fully mature yet.
okay.
Um, Genetics, they don't really play a role the way they play a role in other diseases, but they've seen some genetic polymorphisms or different genes that can be found in certain populations, and those may interact with environmental factors to increase the susceptibility to SIDS, but they haven't really found any like gene specifically, just like different different genes that can be found. I actually have a list of them, but I figured it was way too much detail to go into.
Yes.
Yeah, but just like a general thing to keep in mind. And then, of course, the environmental trigger, the trigger is the big one that we talked about is prone position. We don't know why it causes or increases the risk of SIDS, but it's thought to lead to like decreased arousals. So babies, in the NICU, I don't know if you've ever worked in a NICU, but the babies actually sleep on their bellies in the NICU, and they sleep better. So there is decreased arousal when they sleep on their belly. But the key there is they are monitored with one nurse, like it's one nurse to one baby or one to two babies, and they're on a continuous monitor. So that's why they kind of allow it in the NICU because the babies are being watched 24/7. And then infection, maybe some role there, but it remains unclear. They have found in infants dying from SIDS when they did the autopsy that there's some similarities with those of infants dying of toxemic shock, or that's like the shock that happens after your body undergoes infection. Now, prevention, that's the big one. And that's kind of what we talk about in the pediatrician's office. And even the conversation starts as early as in the hospital. When parents leave the hospital, they're left with packets all about safe sleep. So we do harp on mothers trying to avoid tobacco, alcohol, and illicit drug use during pregnancy, as well as after birth. And they should receive regular prenatal care. Safe sleep, which we've talked a couple of times about now. So baby on their back, dressed to be warm but not too hot, and without a hat, and a crib or bassinet really, that is the mattress that is firm and flat, with no blankets, no pillows, no toys, no bumpers in the crib. A general rule for how to dress baby is they need one more layer than we do. So if you and I are comfortable in a short sleeve, then they need one extra layer. If it's really, really hot outside, if we're going out on a Florida summer day, baby's probably totally fine in just one short sleeve onesie. Okay, no like socks, no blankets,
Definitely
nothing.
in Florida.
Yes, it gets really hot. And then what also prevents it is room sharing without bed sharing, and offering a pacifier at sleep initiation. So right as the baby goes to sleep, because of the evidence that it is protective against SIDS, even if it later falls out of the baby's mouth. And we don't want to put the pacifier or attach it to any strap or anything because that could pose a strangulation risk.
Now, question about that. A couple people asked me, right now the biggest thing is it's cold and people want to layer up in the bed.
Yes.
So
So layering like as the baby sleeps.
yeah, so what would be also I've seen somebody say like even if in the summertime if it's warm, try to keep the um even if it's cold and for instance you have the heater on, babies can't
Right.
really be in the heat. Like try to keep a fan or something circulating so that baby won't get hot. Like a lot of people don't like, oh, it's been 20 degrees, let me turn the heater on 78 and then the baby on the blanket. Like that's a lot.
Yeah, it is a lot. You're absolutely right. So it's the same rule. Like if it's 20 degrees out and we have the heater set, I wouldn't set it too high. I have a lot of parents who like are setting their thermometer to or thermostat to like an uncomfortably high temperatures because they're worried about the baby. But I usually say set it to what's comfortable for you. So for me and my husband, for example, 70, we leave it around 71, 72. So when our baby comes, that's what we're going to do. We're not going to change that temperature. And I'm comfortable in a short sleeve and shorts in that temperature. So the baby will just be in one long sleeve layer. The blanket does count as a layer. So we don't really need to, so whatever temperature is inside the house is kind of what we go based off of. Did that answer the question?
Yes, that did. That really
Okay,
did.
good. And then breastfeeding is recommended for possible effects on reducing risks of SIDS, especially for the first 2 months of life. And then I get asked a lot about these like home monitors these days. Like they try to sell parents a lot of things. Even for me as a pediatrician now trying to build my registry, I'm very overwhelmed with the amount of options that are out there for baby and parents. And I'm like, do I really need this? Do I need this? Do I need that? So they'll try to sell you this monitor. And there's actually not enough evidence to really support the use of it at home. They tried actually two of these devices in the hospital, and they found poor correlation with the standard pulse oximeter. So when babies in the hospital, we put the pulse ox on them, and then they put the device on them as well, and they found that it wasn't correlating. So it actually resulted in many false positive and false negative readings for both the oxygen dropping and for slowed heart rate.
Hmm.
So, yeah, so really these monitors can lead the parents to feel like this false reassurance where,
Right.
hey, baby's fine because they have this monitor, and it causes parents to maybe drop their guard down a little bit about safe sleep. And then if it keeps beeping, it can cause a lot of anxiety and overdiagnosis and unnecessary testing. So it's actually not recommended to really have one.
Okay, because I've been seeing, like you said, though, a lot of people
Yeah.
selling those. It was something popular thing that was. It's probably been around. It's like a sock thing. I seen it on TikTok or something.
Yes, that's the one. Yep,
That's the one.
that's
Okay.
the one. The owlet or something.
Yes, and I'm
Yeah,
like, I
yeah,
ain't never heard of that, but it must be something
yeah,
new. But then,
yeah,
like
it
you said,
is.
a mom actually did a thing on it. She was like, she didn't let her guard down. She was like, she just went over there to check. She was like, this is not right. So
Yes,
she was
exactly.
okay. Yeah.
Exactly. So they're not really recommended. And it makes sense why maybe like